Welcome to the Rewind podcast. I'm here with Christelle, and we thought it was a good idea to start doing publishing some questions and answers. So we get these questions all the time in our consults, and we get these all the time when people call us asking about our services. So we wanted to just start putting out some videos. So I'm going to turn it over to Christelle. Let's go with question number one.
Thanks, Brian. So question one, how can a guy know that he has low testosterone levels?
Okay, I'm going to start first with the symptoms. A guy can be dragging energy-wise. He can have a difficult time losing body fat. He can have a hard time gaining muscle mass. Cognitive functions, needing a nap at night. And then a big one, which we find when we're in private discussions, and I think even when guys ask when they call us, is reduced libido from when they were much younger. So I think those are some of the symptoms. And then obviously we have lab reports that will give us a sort of range of where someone's at. In addition to that, so we'll swing over to our website. On our website, we actually have something which is called the ADAM questionnaire, and it stands for Androgen Deficiency in Adult Males. So we get a lot of forms submitted through our website, and these are 10 questions that guys can respond to that can indicate that you have a androgen deficiency, low testosterone, if you have a score of over 30. And so if you want to go to our website, we'll do it really quick right now and we'll just blow through it. So I'm Brian Burke. This will put in your email, you put in your phone number. And then the first question is, do you have a decrease in libido, sex drive? So let's say, if I were going to a clinic the first time and I was experiencing this, I might say yes. Do I have a lack of energy? So at night, am I able to go to the gym? Do I have energy to go out? If the answer is yes, I would select yes. If it was no, I would say no. But in most cases, guys who are in the middle age would say yes. Do you have a decrease in strength and or endurance? This is another issue that a lot of clients articulate to us. So let's go yes. Have you lost height? A lot of guys aren't going to probably know that they lose height. But interestingly enough, when we do our body composition weigh-in at the office, a lot of guys they think that they're 1 to 2 inches taller than they actually are. And so we notice that quite a bit. So let's say no, because I would say no. I would think that I haven't lost any height. Have you noticed a decreased enjoyment of life? Let's say that my life is still pretty good. So let's say no, even though that is often the case. Am I sad and or grumpy? Maybe I could possibly be the grumpy old man, as we've heard of a million times. So I would select yes. Are your erections less strong? This is something that a lot of men confide with us when we have our individual consults, that yes, that when they're much younger, their erections are much lower. I think even guys, when they call on the phone, as you would attest to, also probably articulate that as well, right?
Definitely.
So let's say yes, they are. Have you noted a recent deterioration in your ability to play sports? Let's say no, because maybe I don't play sports anymore. As a 52-year-old guy, I don't play sports that often. Are you falling asleep after dinner? This is one that I personally remember when I was about 5-6 years old. I would go into the den with my grandfather after dinner, and he would be nodding off for like 15-20 minutes taking a nap. I don't know anyone who's ever seen a father or has become a father themselves. This happens quite a bit. And it used to happen to me before I went on testosterone. So it always makes me think about my grandfather. And has there been a recent deterioration in your work performance? I know prior to going to a clinic, I was definitely having mental fog issues and concentration issues. And that was actually one of the biggest reasons why I ended up going to a clinic and starting with hormone replacement therapy and testosterone replacement therapy in specific. So if we submit this, let's say yes. On the website, it's going to tell us that we, in all likelihood, have an issue with low testosterone, and your results get sent to us, and then we end up contacting you. So there's a good form, good questions that if you can answer yes to more than 3 of those, you're probably low in testosterone. So those are good signs that you might be low T.
Nice. Well, not nice, but
Exactly.
let's get you better.
It's not nice being low in T. There's good
Yeah.
news and bad news. So we always tell people when they come to us, there's good news and bad news.
Definitely.
The bad news is that your hormones aren't perfect. The good news is we can
Offer
change
a
that.
solution.
Exactly.
Well, thank you so much for that information. You can find the Adam questionnaire in the link in the bio area, and follow us, subscribe.
Yeah,
Turn on
like
your
us.
notification, like us,
Smash the like button.
and let us know in the comments below if you have any questions or any topic you want us to delve into further.
Absolutely. This was a Rewind podcast, and we'll see you guys in the next episode.